Have you heard of the hangman fracture? It's actually a fracture at the second cervical vertebrae. It can be a break in the bone or a misalignment of the second cervical vertebrae due to hanging, fall, motor accidents, or impacts of high force. Do you know what can be the devastating consequences of this fracture? Yes, you're right. It can result in a complete paralysis, even quadriplegia, that is affecting all four limbs. If you watched my lecture on spinal cord anatomy, you must know what cervical vertebrae is. Our spinal cord is surrounded by a vertebral column that is made up of small vertebrae. Vertebral column consists of 5 segments: cervical segment, thoracic segment, lumbar, sacral, and coccygeal segment. Vertebrae present in the cervical region right below the head in the neck are called the cervical vertebrae. The name cervical vertebrae has been derived from the Latin word cervix, meaning neck-like. There are 7 in number. Out of these 7 vertebrae, from C3 to C6 are classified as the typical cervical vertebrae because they're nearly identical. Remaining C1, C2, and the last vertebrae, C7, are all atypical in shape. Now you can appreciate all of these cervical vertebrae over here and the differences among the typical and the atypical varieties. It is so interesting that even animals having long necks, such as giraffes, have the same number of cervical vertebrae as humans. Imagine such a long neck yet still having 7 cervical vertebrae. How amazing is nature? This shows the versatility in the architecture of these cervical vertebrae. Now, if you'd get a question to identify a cervical vertebrae, it might confuse you if you won't pay attention to me during this lecture. So hang on and let's go through this interesting topic together, which is the cervical vertebrae. Basically, the vertebrae in your neck. The main identifying feature of the cervical vertebrae is the foramen transversarium, which allows the passage of the vertebral artery, vertebral vein, and the chain of the sympathetic plexus. Two added features that will help you identify them are the bifid spinous processus and a triangular vertebral foramen. Now remember this important fact that we have 7 cervical vertebrae, which includes the typical variety from 3rd to 6th and an atypical variety which includes the 1st, 2nd and 7th cervical vertebrae. So in this lecture, first of all, we'll go into the anatomical details of a typical cervical vertebrae, and then we'll look at the 3 atypical one by one. So let's buckle up and learn together.